Tonight, the CDC is telling governors across the country that the agency is preparing to distribute coronavirus vaccines possibly as soon as this fall, and they want states to start getting ready now. Thanks for joining us tonight at 10 o'clock. I'm Dan Spieler.
And I'm Birshel Admei in for Fanchon Stinger tonight. Fox 59 has confirmed Governor Eric Holcomb received a letter. It asks states to help distribute facilities and become fully operational by November 1st. That's 2 days before the election.
A lot of people hoping this can happen, but a lot of serious questions about all of this as well. Fox 59's Kelly Rinke live in the newsroom now with the questions health experts are asking about this plan. Kelly.
Dan and Birshel, we just found out about this letter earlier this afternoon, so not much is publicly known about how this will all play out in Indiana. Even if a state vaccine is available this fall, some believe we still have a long way to go. Potentially promising news in the fight against COVID-19. A letter from the CDC to governors says it's preparing to implement a large-scale distribution of COVID-19 vaccines in the fall.
Is it going to be sent to every pharmacy, every doctor's office, every hospital? What is the stage of administration of this vaccine?
These are the questions Assistant Professor Anna Bento is asking. She's been researching COVID-19 transmission since January.
The sooner there's a vaccine available, the sooner there's a hope for a more robust control strategy for COVID-19.
The letter says the CDC has contracted with McKesson to distribute vaccines to health departments and doctor offices. It also asks governors to consider waiving requirements that would prevent these facilities from becoming fully operational by November.
This is a necessary part of being able to deliver a vaccine. You don't just create a vaccine, you actually have to have a way to distribute it.
Sean Granis at the Regan Street Institute analyzes COVID-19 data in Indiana.
I don't know that I see the evidence that we're going to be ready on November 1st, but I'm hopeful. Perhaps there's information that I don't have access to.
On Sunday, the commissioner of the FDA told the Financial Times the department could authorize a vaccine before the end of phase 3 clinical trials, as long as officials believe the benefits outweighed the risks.
There will have to be a very high number of people protected, vaccinated, in order to achieve what we've been talking about herd immunity.
And according to this letter, the distribution program could potentially involve hundreds of millions of vaccine doses. Governor Holcomb's office says they will work with the CDC and McKesson on next steps, guys.
It's all very interesting here. Now, the question is, did the letter tell us who would get that vaccine first once it's available?
Yeah, Birshel, it did not, but that's a question infection preventionists in Indiana are definitely asking. They wonder if there will be enough doses to vaccinate everyone. Will we be able to vaccinate babies? Who will be our target population? And of course, they're actually asking if these vaccines have any side effects.
So big questions that we're still waiting for answers. Kelly, thank you for that report.
Well, a warning tonight from state